How to prepare for your TB test. Preparing for a tuberculosis skin test can feel a bit daunting, but it's quite straightforward. This test, also known as the Mantoux test, helps determine if you have been infected with the bacteria that cause tuberculosis. Here are some essential steps to ensure everything goes smoothly. First, it's important to understand the test procedure. A healthcare provider will inject a small amount of purified protein derivative just under the skin of your forearm. This will create a small raised bump, similar to a mosquito bite, which usually disappears within a few hours. The injection is quick and should cause minimal discomfort. Next, share your medical history with your healthcare provider. This includes any previous TB tests, vaccinations, especially the Bacillus calmette-guerin vaccine, immune system conditions, or recent illnesses. This information is crucial for interpreting your test results accurately. When scheduling your test, plan for both the initial visit and the necessary follow-up. You will need to return to the healthcare provider between 48 and 72 hours after the injection to have the test site examined. If you miss this follow-up, the test results may not be valid. On the day of the test, wear clothing that allows easy access to your forearm. The healthcare provider will clean the injection site with an alcohol swab before administering the tuberculin. It's best to avoid applying lotions, creams, or bandages on the test site to ensure accurate results. After the test, keep the injection site clean and dry. Avoid scratching, rubbing, or pressing on the area, as this can irritate the site and affect the results. If you experience mild itching or discomfort, a cold compress can help, but do not apply ointments or cover the area. Watch for any side effects, such as redness or swelling. If you notice severe reactions like extreme swelling or difficulty breathing, seek medical attention immediately. If you are due for any live virus vaccinations, such as measles, mumps, rubella, or varicella, it's best to have the TB test on the same day or wait at least 1 month after the vaccination before testing. Inactivated vaccines do not interfere with the TB skin test. Finally, if you have a history of receiving the Bacillus calmette-guerin vaccine, do not skip the TB skin test. Your healthcare provider will know how to interpret the results appropriately. If you have risk factors for TB exposure or immune system issues, additional testing or follow-up may be recommended. In summary, preparing for your TB test involves understanding the procedure, sharing your health history, scheduling the test and follow-up correctly, caring for the injection site, and coordinating with any vaccinations. Following these steps will help ensure that the test is accurate and effective in diagnosing TB infection. Always consult your healthcare provider for personalized advice and guidance.